Radhe Radhe to all, and I hope everybody is doing perfectly fine. So today we are going to discuss thyroid function test in short. The basic, what type of test it is, how it should be done, what is the procedure to collect it, and what are the basic interpretation and when you should go for this basic test. So thyroid gland, as we all know what it is, basically a butterfly shaped gland hota hai. Here you can see respiratory tract ke above, just in front of your trachea. So this is the butterfly shaped left and right sided thyroid. With we have in between we have isthmic portion of the thyroid gland which is connecting your right and left lobe of thyroid. So this is one lobe and this is another lobe, and the mid portion is your isthmus. So basically what it does, so this gland it secretes hormone in blood, and through blood it goes to different tissue. फिर वो वहाँ जाके करता क्या है? What is the basic function of thyroid hormone? So it helps the body use energy, stay warm, keep the brain, heart, muscle and other organs working in working condition. So what is TFT? As common people say, thyroid function test, TFT. So basically what we do in thyroid function test is we measure the hormone levels which are produced by our thyroid gland, and with that hormone level we are able to assess the health of the patient, and any kind of disorder can be diagnosed related to thyroid abnormality. So first the important one is your TSH. बहुत पेशेंट में आप देखते हो पेशेंट जो मतलब जिनको थायराइड हाइपोथायराइड है या दे आर नोन दे आर ऑन ट्रीटमेंट दे आर रेगुलर मतलब टेकर्स ऑफ योर थायरॉक्सिन. सो व्हाट दे डू इज दे ओनली गो फॉर मॉनिटरिंग अगर करनी है कि डोज के अकॉर्डिंग थायराइड हार्मोन्स करेक्ट जा रहे हैं तो देन वी जस्ट मेजर TSH. So that is sufficient. So basically, but TFT comprises your all the three: TSH, T3, T4. So TSH जो है ये secrete होता है pituitary gland बनाता है इस hormone. It regulates the production of your thyroid hormone because we have all the axis here, all the hormones are regulated by CNS pituitary, correct? So often the first test है TSH basic है क्योंकि एक sensitive indicator है of your thyroid function. So when next coming to T4, T4 is a main hormone which is produced by thyroid gland, और T4 क्या होता है बाद में वो convert हो जाता है T3, that is more active form in the body. So both T4, total T4 and free T4 can be measured. Similarly T3 भी हम जैसे total T3 and free T3 we can measure. So T3 is usually less commonly measured, but important in diagnosing your hyperthyroidism and assessing the severity, how severe hyperthyroidism is. So basically we have to remember these are basically three hormones which are there in this T3, T4, TSH. Then why we need to do this test? To diagnose various thyroid disorders like hypothyroidism, मतलब आपका thyroid जो वो underactive है, उतने hormones को produce नहीं कर पा रहा. Hyperthyroidism means your thyroid is overactive, it is producing too much of hormone. So then for diagnosing thyroid disorder we need TFT, then we need TFT for monitoring the patient who are already, as I said you in last slide, the patient who are already diagnosed with thyroid. So TFT, what it will does, it will help us in assessing the effectiveness, how patient is responding to the treatment, or if is there any requirement to adjust कि उसके dose को कम करना है या बढ़ना है. Suppose कोई hypothyroid का patient है, उसके TSH 9-10 जा रहा है, even after taking the proper जो 50 microgram है फिर भी, so then what the clinician will do, they will increase the dose of thyroxine, correct? So that is why to adjust the dosage of medication, we need to have a value. So how it is done? Usually we need blood sample from the vein in the arm and collect कहाँ करना है? Red vial में. Red vial has no anticoagulant, so we call it as a plain vial, red capped vial. So thyroid hormone के लिए sample इसमें जाता है. And another question people ask, fasting. See, every test does not require fasting sample. आपको भूखे रह के sample देने की जरूरत नहीं है. तो usually thyroid function test don't require you to be in fasting stage. So we don't need the patient in fasting, come, do not have anything and come, it is not required. But yes, some subclinical cases, according to your clinician, if he feels like he needs to have a fasting sample, so better you consult your clinician before you come to give the sample. The results are you after the blood sample is collected. So TSH, T4, T3 are measured, and the results we have certain standard values, so we compare it with it. Then there can be minor variation from lab to lab in their range, so that might vary. So these are the basic normal value which we should remember. Total T3 होती है 80 to 220 nanogram per deciliter. Units are very important because sometime if you use mg, so this will change. So total T4 is 5 to 12 microgram per deciliter. TSH in the range of 0.4 to 4, usually 0.4 to 2.5 is the average optimal range in adults. Then interpretation. Suppose TSH हमने कराया, बहुत sensitive marker है, hormone produce होता है pituitary से. So what? अगर high TSH है means patient is hypothyroidism. So now how hypothyroidism patient will present? It means gland is not producing much of hormone. तो hypothyroid के patients कैसे होंगे? लोग कहते हैं ना मैं thyroid है, मैं मोटा हो रहा हूँ. It is not mandatory. If your thyroid hormone TSH is increased, you will have this kind of symptom. Fatigue होगा patient को, weight gain होता है, cold intolerance होती है, dry skin हो सकते हैं, hair loss हो सकता है, even depression. So hypothyroid patient can have all these symptoms. Then when we go for low TSH means hyperthyroidism. So gland is producing too much of hormone. तो अगर hyperthyroid है patient, ठीक है, TSH बढ़ा हुआ आ रहा है उसका, so the patient will present to you with weight loss, rapid heartbeat, दिल की धड़कन तेज हो जाती है, then increased appetite, anxiety, sweating, stimuli like the sensitivity to heat. So all these patient will present to you with hyperthyroidism. So T3, T4 are required because it further clarifies the diagnosis. And when we need to undergo for different thyroid disorders, we need to have these values. So thank you so much for your patient hearing. Kindly like, subscribe, and share my YouTube channel Patho with MK. Thank you.